So how can you prevent eczema, or at the very least prevent flare-ups from eczema?
So it's probably quite difficult to prevent eczema altogether in the vast majority of cases, because we're talking about a genetic predisposition towards eczema. So you might get patients or people who have got eczema, they've got asthma and hay fever. So this is this kind of genetic predisposition to what we call atopy and these conditions altogether. However, there are a number of things that can result in a flare-up of eczema, and those are things that you can certainly avoid. So things like irritants in your environment, and that can be as simple as lots of contact with water, and not that I would avoid water altogether, but overwashing, for example, overwashing of your hands, or essentially using lots of harsh soaps. And so I would always advise someone with eczema to avoid soaps altogether.
So anything that removes oil from the skin?
Yes, exactly. And anything that introduces irritation as well, because anything that lathers up is not great for your skin. So I say that things that bubble are trouble, really. So that's a very, very important thing to avoid. In addition to that, you can flare simply as a result of things like other types of irritation. So it's important to avoid certain types of fabric. So we say to just have things like cotton next to your skin rather than wool. And a cold, dry climate is also not great for your skin. So that's more difficult to avoid in the UK, but it's important to be aware of. And then we know that people with eczema do tend to have more, they tend to be more prone to allergies. And I'm talking about contact allergies, so things that you come into contact with in your environment. And that's more difficult to know if you are allergic to something, but there are tests that we can do if for example, I had a suspicion that you were allergic to a specific thing.
If you notice that you have any of the symptoms or the conditions that we've just discussed, we invite you to book a consultation with Miss Penelope Pratsou, where she'll be able to assess your condition and give you a treatment plan.